Dr. Vonda Wright is an orthopedic surgeon, if you didn't know, but I'm sure all of you do, and internationally recognized for her expertise in mobility and active aging. And with Vonda, active aging is not an oxymoron. She specializes in sports medicine and is one of only a very few orthopedic surgeons in the United States, which is a tragedy. But she's not. She is the inaugural medical director of the UPMC Lemieux Sports Complex. She's appeared on Dr. Oz. She's been on The Doctor. She's frequently quoted in the Wall Street Journal, New York Times, USA Today, and US News and World Report. She is everywhere. She is the expert on senior aging and staying mobile. She earned her first BS, she has two, from Wheaton College, her second, a BS and a master's in oncology nursing at Rush College, and her MD comes from one of the most esteemed academic institutions in not just the country but the world, the University of Chicago. She completed a residency in orthopedic surgery at the University of Pittsburgh, and that's what brought her to us, and thank goodness she stayed. She also had a fellowship in sports and shoulder surgery at the Hospital of Special Surgery in New York. She practices at the UPMC Center for Sports Medicine, serves as the team doc for the University of Pittsburgh Olympic sports teams and the Pittsburgh Ballet Theater. And if that isn't enough, she is a wife and mother. She lives with her husband, as you just heard, two-time Stanley Cup champion, Peter Taglianetti, and their blended family, and that is no easy task, and they do it beautifully. Of 6 children right here in Pittsburgh, it is my great honor to introduce to you Dr. Vonda Wright.
I am from Chicago, but I love living in Pittsburgh. And I'm sorry you're stuck with me, I'm never leaving. Why would I leave a transformational city like this? I'm just astounded by what the mayor said. You know, my own office is built on the old Bethlehem Steel site, where I hear that below us is all the steel of the century, but now it's a place for rejuvenation and transformation. And I'm just so proud to live here and work here. And this is the right city to start and ignite a national conversation in women's health, because as you heard the mayor say, we've reinvented ourselves before. And we're gonna do it again. It is a weird place we are now with healthcare in this country. And frankly, it's a little weird place we're in with the healthcare in this city. But if you want to figure it out, this is the group that's gonna figure it out. I'm not kidding. You have the power to do it. Because I believe that this group is the most powerful group in the country. There's a myth out there that aging is an inevitable decline from vitality down some kind of slippery slope to frailty, and that it's inevitable, and that there's nothing in the world we can do about it. And that's kind of a hopeless message, isn't it? But the fact is, and the data shows, that 70% of our health and aging is due to the lifestyle choices we make every single day, which means that only 30% of our health is determined by the genes we inherit. And so my mother, who is here today, is so relieved that I don't blame her for my health anymore. And neither should you, if your mother is here. 70% of our health is determined by the choices we make. And it puts us in a really powerful position. And that fact, on top of the fact that, come on, ladies, we already make 80% of the healthcare decisions in this country for ourselves. We make them for our colleagues. How many times have you been at work and somebody says to you, hey, who do you go to for this thing? Or I've got this thing if I can't get rid of this cough, what should I do? And you recommend health decisions to everybody you work with. And if you have little people in your life, whether they're your own or the neighbors or your sisters, you make decisions for them too. We make decisions for everybody in our lives. And we're powerful, and if you take one thing away today, it's that you are powerful and that it is not an inevitable decline from vitality to frailty. But the question, ladies, is what are we doing with that power? I can tell you what we're doing. We're letting it go. 30%, the statistics on this are pretty puzzling to me, and if you can tell me how to motivate better, galvanize better, I will listen all day long, because the fact is only 28% of us in this country invest every single day in our health. 28% spend 30 minutes a day, whether it's on mobility or going to the fresh market instead of the pre-packaged market. 30 minutes a day is not a lot to prioritize and invest in our health, and yet only 28% of us do it. And we discussed last year at Women's Health Conversations why that could be. Well, there's this disconnect. Honestly, there's a whole field of study now. It's called temporal disconnect. And what it says is true in health, it's true in banking, because banking can't get you to save your money, and I can't get you to invest in your health every day. But this is why. Because if we're thinking, I'm going to make great decisions for 20 years down the lane, I don't know what I'm going to be like in 20 years. I don't know that person. I don't even know what she's like, what she looks like, and so I'm going to ignore that person. And so frankly, we're jerks to our 20-year selves. We don't take care of that person like we would take care of a friend today. And there's this temporal disconnect between the decisions we make today and the decisions we make tomorrow. So we're powerful, and we just need to grab that power. And so we make decisions for everybody. And I think one of the reasons, besides temporal disconnect, that only 28% of us invest in ourselves is because we prioritize everybody in front of ourselves. We're women. It's what we do. I was a nurse, trained by one of the best nurses in the country who's here today with us, Anne Marie, and we prioritize everybody else, and I'm guilty of it just like you. But you know when you're in that plane and you're about to take off, and the person comes on the loudspeaker and they're like, put your seatbelt on, you know how to do it, you've done it a dozen times. But then they say, and then the air mask is gonna, in the event of depressurization, the mask is gonna come down. And what do they say? They don't say, grab it as quick as you can and put it on the person beside you. They don't say that. Take care of that person because you're not important enough. No, they say, put it on yourself first, and then you can help whoever's beside you. But what they don't continue and tell you is that if you don't help yourself first and the oxygen goes away, you will suffocate and you will not be able to help that person beside you you love or the person in the row ahead of you. You must prioritize yourself first so that you can help everybody else that may need you. And as women, that's what we need to do, because we're so giving and we're so busy that we do put everybody else first. But if you prioritize yourself first, it not only makes you more able to take care of everybody else, but you know, I gave a talk recently for Pittsburgh Magazine where we talked about prioritizing your own health actually helps you get to the sea level faster. So if you don't want your health, if you want to be in the sea level, get healthy, and that will help you get there faster. There are lots and lots of reasons. So ladies, we are powerful. We do not have to slip down this slope from vitality to frailty. So I'm going to really quickly, I have a few points today to make. I want to give you a framework for what you're going to do today, because when you leave me here from this room, we're going to some of the most amazing master classes on health and lifestyle that I could imagine, and I brought in all these amazing speakers for you. But here's a framework. In my second book, on which this conference is based, called Guide to Thrive, 4 Steps to Body, Brains, and Bliss, I actually borrowed from the business community. I'm not a business person, probably never will be, but you guys have it figured out. You are good at strategic planning, right? There's a stepwise process, you evaluate it, you adjust. Nobody does that in health. If you have a strategic plan for your health, I want you to stand up because we're going to applaud you. You plan everything else, your career, your children, somebody else's children, everything you plan. But I propose to you that you don't have a strategic plan for your health. So here's a framework that I have borrowed from business. There are 4 steps. Number 1, create a vision for your health. You can't know where you're going unless you examine who you are now and where you want to be. The author Thoreau has this really famous quote that I just love. It ends with, live the life you envision. It takes purposefulness to do that. It takes examining what I really want. Why do I really want that? And in more modern books, Andy Stanley, who wrote a book called Visioneering, says, if you are able to examine yourself and know what's important to you, and who am I really, not who I think I am, but what do my actions say about myself, and where do I want to be, that kind of examination and casting a vision and writing it down puts meaning to the otherwise meaningless blocks in our life. So for instance, here's something. If you go on the Mediterranean diet or the grapefruit diet or some other thing that you pick up in the newsstands, and you have no vision for why you're doing it, you'll be off that diet in about a week and a half. Because there's no reason, right? If you say, I'm gonna just start exercising without a goal or knowing why or how it fits into your vision, the statistics are 50% attrition rate. I can tell you in my own classes at the UPMC Center for Sports Medicine, in which people pay us to exercise with experts, there's a 50% attrition rate, because we must know why we want it. Why do we want to be healthy? Is it for me? I hope it's for you. Is it for your family? Is it so you'll be around? You know, my own vision, I want to be as healthy as I can be, and I made a big change after last year's conference I'm going to tell you about, but I want to be as healthy as I can be because I want my brain to be as good as it's going to be. And I want my hands to be as good as they're going to be for the work I do. But I'm raising a 7-year-old, and I had her really late. And I've got to live long and prosper for her. And I have these 5 stepchildren who are all going to start having grandchildren pretty soon, and I need to raise those babies. So I've got to do it for myself, and I've got to do it for my family. And so knowing that vision puts meaning to these bricks. Otherwise, you know, I'm as lazy as the rest person, I wouldn't do it. But if I know why, then we're creating a vision. Number 2, we have to take action. In my book, we talk about taking action by moving and eating. And I'm not going to get into this a lot today because you have amazing masterclass teachers. They're going to talk about it. But when I talk about moving, I'm not going to prescribe for you a 12-week program of exercise. And when I talk about eating, I'm not going to specifically tell you what to eat, although I could if you wanted me to, just pull me aside. You have 3 nutritionists here today, Leslie Bonsi foremost, that you know, Kathy Perry and Sanjeev Javia here today to talk to you about nutrition. But I want you to realize what you're doing when you move and when you eat. There's this whole new field called epigenetics. Have you heard of that? Yeah, epigenetics, and Dr. Maroon is going to be here today talking about epigenetics, but basically what it is the study of how mobility and the food you put in your body is not just hanging out somewhere in your fat layer, but it really changes the way your genes transcribe. Transcription means what genes are turned on. It means what your body actually does. So broccoli, for instance, it's a good example I like to use. Eating broccoli is just not being healthy. Or whether you put cheese on it or not, that's, yeah. Eating broccoli causes your body to activate all kinds of antioxidant systems, which changes you on a cellular level. You don't think about the food you eat changing the way your genes are working in you. So it's not just this lifestyle choice is going to help me fit into the black dress, because don't get me wrong, this conference is not about you fitting into a black dress. This conference is about you transforming your health. But choices like whether to eat broccoli or whether to move and make your genes transcribe life pathways is the field of epigenetics. So we take action through this. I want to tell you, if you've heard me speak before, you may have heard this story often. I love to use this. The effect of mobility on our genes. I am a researcher. I publish studies on the role of mobility on musculoskeletal aging, because I don't believe that we're going to have to slide downhill. So I do this not only on people, but I have these mice. And we let these mice hang out, and they get old. An old mouse is 2 years old. She's a little old mouse. She's a grandma mouse sitting in her cage, and she just kind of sits there like this. So we took a biopsy of some of these mice thigh muscles. It really doesn't hurt. And we separated the stem cells, the cells that are supposed to rejuvenate us. And in little old sedentary mice, these cells, when we put them in a petri dish, they sit there and they don't make any growth factors. And in fact, they don't stay round and healthy like a grape, like a healthy cell should. They get all spindly and wiry and old looking, and they do nothing. In fact, they start transcribing genes towards death. Then we took these little old girls and we put them on my treadmills. There are mouse treadmills, just like there are human treadmills. And they don't want to run just like we do, so they slip down to the back and they sit there all like this, but we have ways. And then we run them for a half an hour for 2 weeks. 2 weeks. I know, you gotta come to the lab and see it, it's something. We run these girls for 2 weeks, and what happens to their stem cells? Their stem cells become young again. When we put them in culture, they start secreting the growth factors that rejuvenate our bodies. They stop transcribing genes that lead them towards death and start transcribing genes that lead them towards healthy life pathways. They stay round and plump like a healthy cell and not spindly and old. We control our cells in the same way that these little old girls do through one small change a day. So we create a vision. Why do we want to be healthy? We take some action, and you're going to hear it today in our master classes and in our pavilions. If you go to Andrea Metcalf's pavilion to this afternoon on fitness, she'll have you up and moving, and you'll be transcribing good genes. I promise. And then our third step after creating a vision, taking action, is changing our attitudes. What has kept you from this before? Why aren't we optimized in a health-wise? And I hope that you know that when I say these things to you, I'm not saying them standing in judgment of you. I'm not, you know. I realize life goes on. I skipped my mammogram this year. I rescheduled it, and we're good now. But I did it for the same reason you do it. Because I've got a full household with 6 total children and 2 new puppies. I have a real life just like you, and I skip what's good for me. But you got to examine the attitudes about why we don't prioritize ourselves first, or what makes us reach for the ho-ho when we're feeling bad. And when I was in residency and I was feeling bad that I was up at 3 o'clock and everybody else was asleep, mine was cheeseburgers and french fries from the cafeteria, because we knew that it closed at 2 and you had to get there before it closed. So I get what we do, but you got to examine what's keeping you from your optimum health and try and find ways to step past that and change our attitudes. And finally, if you do that, what we know is that mobility and making the right choices with food actually leads to bliss, because who doesn't want to be happy? There are a lot of books out there right now, and Kevin Soden's going to be speaking about happiness today. 30-minute burn in the morning, or 20 minutes, we can get away with 20 minutes. A 20-minute burn in the morning, a physical exercise burn, produces as many endorphins in your brain as 1 Prozac. So I personally would rather feel lifted, if I can, by burning in a gym or burning in my treadmill than taking a pill if I can. And it's a good adjunct. You know, there's a big body of literature now that shows we can actually change the natural history of dementia and Alzheimer's by lifestyle modification such as intense exercise. We are in a powerful place to change our brains, to change our bodies, and to give ourselves bliss. And ladies, we need to prioritize ourselves, because we're important enough to make this investment every single day. And that's what we're here about today. I'm so pleased you've taken the time to prioritize. I want to talk about two more things before we move on. Have you heard of Yentl Syndrome? Have you read about it? It's been in the news a little bit lately. I came upon it recently. You remember, some of you are old enough in the room to remember this movie. Yentl, the movie, it was about this young Jewish woman who really loved the law. She had to learn. But culturally at that time, she was unable to unless she appeared to be a man. So she appeared to be a man, and she got to learn it the way she wanted. So in medicine, there's the same thing. In the New England Journal of Medicine, there was an article a long time ago about Yentl Syndrome. And in health, Yentl Syndrome is the concept of, unless a woman presents to the medical doctor or the emergency room looking symptomatically like a man, you will not get the same care. I'm going to give you an example. It's not a discrimination thing, it's a knowledge thing. I'm going to tell you about it. Cardiovascular disease, heart attack, is the #1 killer of women in this country, followed closely by various cancers. And the Heart Association is going to be happy to talk to you about this today. They're here, and so is my best friend from medical school, Dr. Susan Kim. Cardiac disease is the #1 killer of women. Women are 1.7 times more likely to die from a heart attack than men. Why is that? Because men present to the emergency room with their heart disease, with crushing chest pain. There is no doubt what's going on with them. So we have a mechanism. It's called Mona in the door. At least that's what I remember, Susan. You can correct me. But we have a protocol. They come in the door. They get these 4 interventions. They go up to the cath lab, and we can help them. But women, because their disease is large vessel disease. That's how men present. Their big arteries shut off suddenly. Women more commonly have smaller vessel disease. So women more commonly present with heart disease as fatigue, shortness of breath. I don't feel like myself. I'm low energy. It kind of feels funny. Probably not because we're being ignored, but because our symptoms are not the same as a man presents, the recognizable symptoms. We may be sent home to take a nap. That's Yentl Syndrome in medical care. So what are you going to do about it? Why do I even bring it up? Well, this is why I bring it up. I want you to be aware of it. I want you to be educated. I want you to take the power that you have to change this thing that we can change. The other thing I want you to do, my other action step is, I know many of you, and you are some of the most philanthropic women I have ever met, and you do good things for research in this city. I want you to make sure that the money you raise is going towards gender-specific studies so that we explore both sides of the coin. 50% of people in this country have a heart, and we're women. And the other 50% have a heart, and they're men. And we need to have studies that examine both sides and not just assume that the way a man presents is the way we're going to present, because even our bones are different. We have gender-specific joint replacements now. So demand care that is consistent with you being female. Demand that a doctor listens to you. It's okay to demand someone listen to you. And most of all, make sure as you're raising all the money you raise for the good research we do in this city, that it is being designated for gender-specific studies. It is a power you have in your hands as the money raisers in this city. Finally, I want to talk to you about the Affordable Care Act. Oh my God, the Affordable Care Act. No. So Dr. Fu, my boss, likes to send out articles from the New York Times. A few weeks ago, he sent out an article about the problem of deductibles. So I read this article. It was done by the study was done by the Robert Wood Johnson Foundation, and this is what it said. Basically, if you work for a private company and have health insurance through your company, your average deductible is $1,200 a year. Well, that's no joke. That's a lot of money. But if you needed something, you could probably scrape it together. With the Affordable Care Act, on the bronze plan, which is the lowest rung of plans, which my brother has, so this really hits home to me. The average deductible, the part that, for the students in the audience that don't know what a deductible is, because you are so lucky to be on your parents' health plan, it's what you're responsible for. The average deductible is $5,000 to $10,000. That is a chunk of cash. And so what this article was talking about is that people are self-rationing. They're not going for their health care because who has that kind of money in most households? Just go get your CAT scan. And then I got really angry when I thought about that, because we have a problem with access to care in this country and city anyway, don't we? And in our problem solving, we've created another problem. But then I really got to start thinking about it. Deductible, the part of our health care that we are responsible for. And I think that we have another area of opportunity, but more importantly, a responsibility. Because our deductible is not just cash. The part of our health care that we are responsible for is the prevention. We control 70% of our health and aging by the decisions we make today. Our deductible, the part that we are responsible for, is the prevention. You can make or break your health with the decisions you make. You can control your deductible every single day. We might not be able to control how much we have to pay if we can get sick, but we can control how often we get sick by controlling our deductible. It's powerful. I'm still angry about access to care, but turning it around, putting the focus back on us. What is my deductible? What am I responsible for? Ladies and gentlemen, you guys are powerful. Today, you're about to leave me and you're about to go meet with some of the best doctors I know in this country, doctors and nurses. And I hope that what you take away today is the power, that we galvanize you, that we send you out as ambassadors to take responsibility for your health, to know what you should do, to control your own deductible. I am so excited for you. You are going to have an amazing day. And I know that we are not destined to go from vitality to frailty. And when we prioritize ourselves, unless we prioritize ourselves, everything else is going to be secondary. You're going to have a great day. And I'm thankful for that you're here and that you have prioritized your bodies, your brains, and your bliss by being with us. Thanks so much.
Find out what's hot for your health at womenshealthconversations.com.